Good day, everyone. I am Mariah Angela F. Pineda, a student nurse from BS Nursing 1. In order to understand ethics, it is important to appreciate the basic concepts of values, belief systems, ethical theories, and morality. We're going to discuss ethics and nursing. Not only are nurses obligated to follow legalities of the nursing profession, ethical obligations will also apply. Now, let's talk about nursing ethics. So what is nursing ethics? It is a system of principles that govern the actions of the nurse in relation to patients, families, other healthcare providers, policymakers, and society. And we also have the Code of Ethics. It is the implicit standards and values for the profession. Included are the ANA's or the American Nurses Association Code of Ethics and the International Council of Nurses Code of Ethics. Now, we talk about the bioethics. So first, let me describe it. It is an interdisciplinary field within the healthcare that has evolved with modern medicine to address questions that arise as science and technology produce new ways of knowing. Physicians, nurses, social workers, psychiatrists, clergy, philosophers, and theologians are joining to address ethical questions in healthcare. And here are some of the dilemmas for healthcare professionals. Included are life and death, quality of life, right to decide, informed consent, alternative treatment issues, stem cell research, therapeutic and reproductive cloning, in vitro fertilization or donor insemination, surrogate, and motherhood or organ transplantation. So, with the ethical decision making, it is a process of answering difficult questions. Included are: what is safe care when staffing is inadequate? What care should be accepted or refused? What does it mean to be ill or well? What is the proper balance between science or technology? And where do we find balance when science will allow us to experiment with the basic origins of life? And we also have to know how to balance science and morality. Nurses must examine life and its origins, its worth, usefulness, and importance. Because nurses must also determine their own values and seek to understand the values of others. Think about the healthcare decisions. Decisions are made with patient, family, other nurses, and other healthcare providers. Nurses must develop a reasoned thought process and sound judgment in all situations that take place within the nurse-patient relationship. Now, we're going to discuss about the values formation and moral development. So first, the value. It is the personal belief about work that acts as a guide to behavior. Next is value system. Is the entire framework on which actions are based. Next is values clarification. Is a process by which people attempt to examine the values they hold and how those values function as a part of the whole. And lastly, the moral development. It is forming a worldview and value system through an evolving, continuous, dynamic process that moves along a continuum of development. We proceed with the ethical principles, and its purpose is establish common ground among nurse, patient, family, or healthcare professionals and society for discussion of ethical questions and ethical decision making. Second, permit people to take a consistent position on specific or related issues. And last, they provide an analytical framework by which moral problems can be evaluated. So the first principle is the autonomy. This is the principle of respect for the person's primary moral principle. its unconditional intrinsic value for all persons. So ma'am, we have assessed that you have a risk for kidney failure related to increased risk for kidney stones. And the best thing you can do, ma'am, is to have a surgery.
I don't want to.
But ma'am, surgery would be good for you.
I said I don't want to. You're so annoying.
Ma'am, you need to have a surgery. I could set an appointment.
Gosh.
Increased risk for kidney stones. And ma'am, let me just enlighten you with the possible procedures you can do so that you can recover.
Alright. Please let me know.
Alright. So ma'am, first is you can take your medicines, and then second is also
Oh, I see. Is it okay? You should document the medicine I need. And also, I have to talk my family first about my surgery.
Alright ma'am, sure. People are free to form their own judgments and actions as long as they do not infringe on the autonomous actions of others. The concepts of freedom and informed consent are grounded in this principle. Second is the beneficiaries. To promote goodness, kindness, and charity. To also abstain from injuring others and to help others further their own well-being by removing harm. Okay, sir. So, we have assessed you and you got a risk for restlessness and acute pain due to smoking. Sir, you should stop smoking. That is very dirty with your mouth. You should stop smoking. Do not use any more of those cigarettes. Alright, sir. So, may I ask how much cigarettes do you consume a day?
Yes, I have 2 packs a day.
Oh, I see, sir. So, I have assessed that you may have a risk for acute pain because of your smoking, and we recommend you to lessen the habit of smoking until you could quit. Will that be okay?
Yes, it's alright.
Alright, so you may also have some alternatives like having some diet meals and also some exercises.
Yes.
Is that okay?
Yes, I will
Alright.
do.
Perfect. Thank you, sir. Risk of harm must be weighed against possible benefits. Common bioethical conflict results from an imbalance between the demands of the beneficents and of those of the healthcare delivery system. Third is non-maleficence. It implies a duty to not inflict harm. It also abstain from injuring others, to help others further their own well-being by removing harm. No, I don't have the schedule for the patient today. I don't even know what medicines are these. Whatever. Right, let me check. That's good. Okay, last. Yeah, check.
Hi, miss. Can I ask,
Yes, sir.
what are my meds today?
So you will be having your vitamin C for today. The last is the veracity. It is the principle of truth-telling. Belief that truth could at times be harmful if it held for many years, and consumers expect accurate and precise information revealed in an honest and respectful manner.
Is it okay if I feel some side effects because of my chemotherapy?
Just don't mind it. It will eventually go. You will live a long life.
Are you sure? Are you sure?
Yeah, I'm sure. You will live a long life. Don't worry.
Is it okay if I feel some side effects because of my chemotherapy?
Yes, there will be some side effects because of the procedure, and you may experience some difficulty as you go with the treatment. But if you continue your treatment, it will give you more possibility to recover. Okay, just continue them and we'll be here to help you. And also you can check some procedures here so that you can continue. This is to develop trust between providers and patients, and truthful interaction and meaningful communication must occur. Challenge is to mesh need for truthful communication with a need to protect well and to look at the ethical decision-making model.
Thank you for watching.